Thank you so much for coming to our second session today. My name is David Duong. I'm a faculty member at Harvard Medical School. And for those of you who don't know where that is, that's because we're on the other side of the river. I see some of my colleagues over here, Dean David Golan, Mercedes Todd Pollack, and other students here as well. Thank you for taking the M2 or however way you got to this side of the river. And I'm also a primary care physician at the Brigham and Women's Hospital. It's truly an honor to moderate this panel and introduce this important discussion on climate change and health in Southeast Asia. Building on the last session where we learned about and heard about the debates around the history of Southeast Asia, and what really was striking to me was just like learning about and hearing about the patterns of migration, the trade routes, things that came through the trade routes. Thank you, Eric, for talking also about diseases that came through trade routes. We're going to now turn our attention to look towards the present and also the future of Southeast Asia and the challenges that this dynamic region of over 600 million people face. This region, as the last session talked about, is made up of islands, it's made up of coasts, it's made up of deltas, which makes it extremely vulnerable to the repercussions of climate change. The increasing frequent and severe extreme weather events threaten the livelihoods, strain the healthcare systems, and erode both the environmental and the political stability of both the region and the world. Rising temperatures and unpredictable rainfall patterns contribute to the spread of vector-borne diseases such as dengue and malaria in previously unaffected areas, and is now making a comeback in areas that have previously controlled them. While we are also seeing extreme heat in places, and that's placing a disproportionate burden on populations already lacking healthcare infrastructure. And we have our megacities in Southeast Asia, such as Jakarta, Kuala Lumpur, Bangkok, and Manila, facing pollution and urban overcrowding. And then our coastal communities in the Mekong Delta coping with sea level rise and salt eroding these rich agricultural baskets that are now threatening starvation and malnutrition. So these impacts of climate change are creating urgent challenges that reverberate throughout the entire region and really threatens the culture and the people that live in this region, but also the world. And addressing these issues demands a robust region-wide collaboration that integrates science, policy, economics, and most importantly, the lived experiences of those on the front lines of this environmental adversity. So this morning, for this panel, we are fortunate enough to have 4 panelists, one from our Harvard community here locally, and 3 from Southeast Asia who've made their way here to be with us today, whose collective expertise, leadership, and dedication exemplify what meaningful and effective collaboration can look like in the fight against climate threats to health and well-being. So the first is Derek Kabe. It's her first time speaking on a panel like this and coming to an academic environment. She is a powerhouse in environmental advocacy from the Philippines. And she has dedicated her life to championing grassroots movements for climate justice, land rights, and empowerment of women. She's a leading figure in the coal-free Bataan movement in the Philippines, where she works tirelessly with local communities to raise awareness about the health impacts of fossil fuels and to resist harmful environmental practices, drawing from her own experience living through these environmental disasters in the Philippines. Ms. Kabe's passionate activism has led her to collaborate with international NGOs, policymakers, and civil society organizations, amplifying the voices of those impacted from climate disasters, but often not present in panels such as these, not present in research questions, and definitely not present in policy discussions. Her advocacy is a testament on how community-led initiatives and community voices can profoundly shape policy conversations, research academic questions, ensuring that decision-making and our quest for new knowledge is inclusive of those who stand to be impacted and lose the most. Next is Dr. Bach Tran. He is the Dean of the School of Public Health at Vietnam National University in Hanoi. And he's pioneered numerous research initiatives focusing on health systems, strengthening disease prevention and environmental health. He has a distinguished academic career, including being the youngest full professor in Vietnam, and an extensive publication record that has not only influenced national health policies in Vietnam, but around the region as well and in the world. His work in monitoring emerging infectious diseases, including those exacerbated by climate patterns, provides a critical evidence for policymakers seeking to safeguard communities. And beyond his scholarship, he's a dedicated mentor guiding the next generation of public health leaders to adopt an interdisciplinary evidence-based solutions for regional challenges. And in his spare time, he is a TV host of national Vietnam television, highlighting the intersection of health, climate, and societal struggles. Next is Enzo Bolentio, who represents the Harvard Humanitarian Initiative. Enzo brings with him a wealth of experience in the humanitarian response, crisis management, and resilience building. He served numerous leadership roles that bridge academic research with practical field interventions, focusing on vulnerable populations caught in the crosshairs of disaster and conflict. His work addresses topics ranging from climate-induced displacement to mental health support in post-disaster settings, always emphasizing the importance of data-driven strategies that empower local communities. He has a strong commitment to rigorous research combined with a profound respect for local knowledge and context, which makes him a pivotal voice in shaping how we understand and respond to climate health nexus worldwide. And lastly, we have the honor of having Dr. Jamila Mahmood here. She's currently the executive director of the Sunway Center for Planetary Health, and she's an internationally celebrated person and humanitarian and physician for her transformative leadership in humanitarian responses, public health, and climate resilience. She founded Mercy Malaysia, which is an organization that delivered critical medical aid to communities in crisis globally, and then has since go on to hold international and global positions, including being the Undersecretary General for Partnerships at the International Federation of the Red Cross and Red Crescent Societies. Her counsel has informed global bodies, national governments, and influential international networks. And she's globally recognized for her dynamic ability to unite diverse stakeholders together. And she exemplifies an interdisciplinary approach, which is necessary to combat the interconnected threats of climate change and health disparities. Her groundbreaking initiatives demonstrate the power of forging strategic alliances because we need them as these challenges are across borders, sectors, and disciplines in order for us to build a more resilient and equitable health systems. So you can see the very distinguished guests here today to share their perspectives from grassroots activism, public health scholarship, humanitarian leadership, and strategic policy collaborations. And the common theme is that we need these different perspectives to create solutions to our climate-related challenges, and that it requires a both top-down and a bottom-up approach. The experiences of local communities must inform scientific research, which in turn should guide high-level policy initiatives, which then in turn impact local communities. The result of this is a circular process which enables innovation and advocacy and really can set a new precedence for collaborative efforts on a regional and a global scale. So I'm going to moderate our session today, and I'm going to start with asking the panelists to share their perspectives and pose each of them questions to allow them to do that. And then we're going to open it up to the audience so that you can share your experiences as well as your questions. And I really encourage students, emerging scholars, and future leaders to seize on this opportunity with our 4 distinguished panelists here today to pose questions so that we can all learn together. Because I think in the spirit of this Asia Center conference about this transdisciplinary approaches, so many diverse voices and experience and curiosity is really vital in us shaping the next, our next response to these climate related solutions. So with that, Derek, I'm gonna start with you. And I think it's so important to start with the community experience, to frame our conversation today, and to start with the experience of those who are most impacted by climate-related disasters. So can you please share your personal experience with climate change and how this has affected your personal experience and your community's response? And how have community-led efforts like yours influenced policy decisions, and why it's important to have voices like yours in your community in understanding what the risks are, what the challenges are, and what the policies that are needed to mitigate and adapt to these risks? Thank you.
Thank you. Thank you, David. I thought I got into a wrong classroom because all of the people here are academicians and medical practitioners, and I'm just I'm a community organizer, and I'm a climate activist, and I really appreciate David and Jorge for bringing me here and to be with you in person. Yeah, as I've mentioned, I'm a climate advocate, but for more than 10 years, I met Dr. Renzo Ginto, whom I believe was also an alumni in Harvard, and we talk about the climate and health advocacy because we've been doing that for many years. It's just that we don't know that it is already the work that we are talking about, we're going to talk about right now. So going back to the question, as all you know, the Philippines is already experiencing the climate impacts. And as I speak right now, classes are being suspended for a week already because of high temperatures on the level of 40 to 45 degrees. So we are not ready with that kind of heat. And on the other side, we experience extreme weather events. Like last year, in 3 weeks, we experienced 6 typhoons in a row, like weekly. So it's really crazy. And aside from being a climate advocate, I'm also a survivor. Like my family is a survivor of climate impacts. And I think this advocacy is very personal for me because our community is being frequented by floodings due to extreme weather events. And can you imagine flooding not once, but almost every year, like twice a year? And if I can only imagine the destruction, the devastation, recovery, devastation, recovery, devastation. It's a repeating process. And, I can only imagine the distress and the psychological and mental distress that my family and my neighbors and the community as a whole have been experiencing because of that. And I think with that experience, my family has undergone and experienced major physical deterioration, health deterioration, as my mom had dementia. It was started when our community had been flooded and they had to stay at the rooftop of our 2-story house 24 hours without water, food, and waiting to be rescued, but they were not rescued. And I was not sure what I was feeling at the time because I thought I'm going to be crazy because if the rainwater would not stop, I would be left as the only survivor because of the whole family would drown. And that typhoon had killed 600 in the country. And that was not the first time. After 2 years, Yolanda, Typhoon Haiyan, had claimed 6,000 lives. I mean, not to mention the not to mention the people who have been missing up until now, and the amount of destruction, the loss of livelihood, the loss of properties, it can be very dehumanizing, because my experience with that series of typhoons had forced us to ask for people's money, ask from people's money, depend on relief given by the government. We had to stay at another house for 3 months. We have to be separated from each other, like the family have to be separated and live at other people's house, because we have my nephew have to go to school. I have to line on relief distribution efforts without the guarantee of relief being given to us. And it has stripped off of our dignity as a human being, as I've mentioned in every discussion that I've been into. Because, without food, without source of income, asking people from help or of help for help, it feels that I'm not a human being at the time, because these are human rights, basic human rights issues, like right to food, right to be safe, right to have houses, right to have livelihood. These are basic and fundamental human rights, which climate change have claimed not only my family, but the whole communities that have been affected by the climate impacts. And I think with that experience, as a survivor, I felt angry. Of course, I felt angry with what's happening. I felt angry with the government, because they were overwhelmed by the chaos, overwhelmed by the challenges. Because for people like us, and especially the communities that I organize, they are at first peasants, farmers, fishermen, women who are being challenged by socioeconomic standings. Climate change has illuminated our vulnerabilities. Climate change have exacerbated the structural inequalities in the society. All of us are being affected by climate change, but not every one of us has the equal impacts, because I am very much challenged with people who ask me, why can't you not move? Why can't you not transfer or go to another safer house? One, is there a safer community with climate change? Second, that's the structural inequalities that plays, because it's not really it's not easy to move from one community to another, because it is our community, it is our childhood, it is our cultural life that has been there for many years. I have been there for many years. My neighbors were there, my friends were there, and just with that, we have to be separated from each other, and I don't know where they are right now. And it's just secondary, because people's lives have been, they were killed. And I can only imagine the feelings of people who have lost their loved ones with climate change. And climate change have, undermined our progress in terms of health, in terms of equality. That's why I think for us as a community and as a community organizer, it is very important to recognize the experiences of these communities as a front line, in the front lines, because they're the ones who are, their lives are being at stake. And it's really in recognition of their contribution, in recognition of their, we campaigns. We do campaigns because it is we do not have a choice. It is our way to protect and defend our rights, not like others who have their choices. It is a question of we do not have a choice. That's why we have to campaign. We have to exact accountability from the corporations who, I think, many of the researches and studies have already proven that it has connection. So why are we suffering? Because of their businesses. And in the community that I organize, 5 coal-fired power plants are operating without, with impunity. It's like they do not care about our rights, because I respect that they have the right to do business, but we also have the right to have a safe environment. We have the right to have our own livelihood. We have the right to have our health, because these corporations have been causing so much pollution and have caused a lot of public health issues like respiratory diseases, and this is exacerbated by climate change. So I think the community has to have a role as much as you have a role, like academicians, researchers, but it can only be meaningful. The research, the studies, it can only be meaningful if we can understand it. And it can be put into policies as we understand it, as the community needs it. That's why we have to foster solidarity with the community, because it won't be meaningful if it is not or if it is not connected. Why do research when it is not connected with how our lives must be put into safety first. So I think lastly, we have to respect the rights of the community to be informed, to be consulted, to be part of the process, to be considered, not just listen, because it's different when you're just listening, when you just want them to be here at present, but you do not consider their voices, because we're not expert. You are the expert, because our experiences are just lived experiences. But we know when things have changed. We know, we observe things from the way our lives have been lived. That's why we have also ideas, and we also have talents and skills. Our indigenous knowledges, our cultural practices have a role to play in the whole efforts of taking action for making our planet more livable in the future. So I think that's it.
Great. Well, thank you so much. Thank you. Thank you so much, Derek, for helping us kind of share that very personal and real story to help us frame our conversation and contributing to our conversation. So my next question is to Bak, and can you build on kind of the experience that Derek just shared about her and her community's lived experience, and how that is also an expertise, right? And the implications on your work as a climate and health researcher, and how you share how scientific research can support communities like those, like Derek, facing climate health risk and the disruption of health services.
Thank you so much, Derek, for a very insightful story. And I think the pictures of the people with repeated suffering from the typhoon is an example of how we think about the traditional health approaches. And this goes beyond all our current epidemiological measures and health services access and utilization provisions. Throughout the process of adapting to climate change, I think scientific play a crucial role through any step of the process, from identifying the risk, assessing the risk, mobilizing the communities and implementing the intervention, and as well as the evaluating the impact. And this provides the fundamental evidence for all stakeholders, including community, the health sector, and other related sectors, and the policymakers. So for community, I would say that it is a gatekeeper for all climate-induced health problems, because many of the issues related to climate change are intangible. So it's not only the data-driven policy, but it's also important to understand the psycho behavior and cultural insight from the communities. Reflecting from our experience in Vietnam, so the Vietnamese preventive medicine system is recognized one of the very effective ones, and it's standalone, but it's supportive to the curative system, and it's organized throughout the level administrative system. And we involve both the formal and informal task force in providing healthcare. And throughout the process of responding to pandemics and through disaster, we have very strong involvement of corporate and all stakeholders within the communities. I would give an example of how we inform the communities by doing a number of social listenings to understand the incident, knowing that the data is used and across the sector sometimes is fragmented and not really directed. So we do a number of social listening, and we involve many task force within the regions and community. For example, the village leaders, the village healthcare collaborators, and many of them are not professional healthcare workers, but they are providing very good information and supporting the implementation of our intervention. And scientific evidence is also important to leveraging the capacity of the health system. Our previous generation of medical doctors and health workers have not been trained or have sufficient information about climate-related disease. And they also lack the capacity for integrate the health policy developments into a broader climate adaptation plans. So evidence provide them with the areas of priorities and also the necessary skill for leveraging up the quality of the services. And for policy making, I think scientific evidence, especially the economics evaluation of climate impact, plays a very important role in facilitate deliberations at the higher level, because it can quantify the intangible impact of climate change into very easy to understand terms like economic term, loss of productivities, burdens of the healthcare system, and the costs related to infrastructures. So all of these together is critical for us to developing a responsive plan. Finally, I would like to emphasize that it is not only the data driven, because we know that it is very important to leverage and mobilize the innovation within each context. We do see that a number of innovation within each communities, very strong, very helpful, but our role is how to make it at a larger scale by exchange idea across the regions. And by doing so, I think the role of university and the community-university partnership is very helpful. Yep.
Great, thank you. And thanks for highlighting that in your work, you've done a lot of what you called social listening and valuing the experience of non-health professionals, as well as highlighting that a lot of people, including healthcare workers and policymakers, are not trained in climate science or climate change, and needing to give them current ones, but also future ones, that type of training to advance this work. So thank you for those two highlights. Next, Enzo, can you build on what Derek and Bach just shared? And as another researcher, can you share with us what it means for researchers to meet people where they are and helping communities prepare for climate-related events? And how has this affected your work around climate anxiety and mental health?
Yeah. Great, thank you very much. So first, it's a pleasure to be here. I'm really grateful to the Asia Center for including me, and the Asia Center has always been extremely supportive of the research that I've been involved in. I'm really pleased to be here with this incredible panel, and I want to relate a little bit my experience of how I got involved in the Philippines. And so Derek mentioned Typhoon Yolanda, or internationally known as Typhoon Haiyan, which happened in November of 2013. I participated in an assessment mission to evaluate civil-military coordination and response to that disaster. And I think it's really important to understand that typhoon in particular really elevated to national consciousness the impact of climate change. The Philippines is a place that, as Derek mentioned, is really accustomed to various vulnerabilities due to climate, right? They've had more than 20 typhoons that come into their area of responsibility each year. They have repeated flooding, but they hadn't experienced the kind of impact that Typhoon Haiyan presented. So this was a true wake-up call, and it clarified some of the weaknesses in the system at that time, and led to a transformation in the way that the Philippines conceived of, thinks about, and prepares for disasters. Just to give you like a context of how much of a shock that was, in addition, so many people died. In fact, we don't even know exactly how many died. There are estimates from 6,000 to 12,000. But there were 21 or 22 international militaries that responded to Typhoon Haiyan. So this was you can imagine as the Philippine government thinking, oh my God, this is not good. We need to be prepared and in control of our own ability to respond to climate change. And it really truly elevated to a level of national consciousness the need to begin to address climate change. So when I was there, I began to ask myself as an academic, how is it that people are really perceiving the impacts of disasters? How do they think about it? How do they experience it? How do they prepare for it? What are the actions that they take? How do they do that at the household level, within their communities, and more broadly at the national level? So I'll connect this back to community, because the way that so one of the things I realized at that time was, in doing some research, is that although there were a lot of studies on disaster response and preparedness in the Philippines, there had never been a household level nationwide survey. And so I undertook to do that with the team at the Harvard Humanitarian Initiative. And what we did in creating the survey instrument was to bring in key stakeholders, so people you would imagine would be involved, like disaster management professionals. But we also brought in community members, and wanting to understand what questions each of them had in terms of what they needed to know in order to better prepare. And we spent a whole day working through these questions in different groups. And then we asked them to imagine that they reverse their roles. So if you were a community member, you are now a professional. If you were a professional, you were a community member. So as a professional being a community member, what would you expect the community to ask that you could potentially provide, and vice versa? So in this process, we identified all of the questions that were important to the people within communities and to the professional disaster management and preparedness system within the Philippines, in order to create the questionnaire that we used and then conducted a nationwide survey, which we did in 2017, and again last year in 2024. And we looked at how people prepare for disasters in three sort of buckets. One was their engagement in planning activities, another was their engagement in training, and a third was in material investments. What did they actually do? Did they strengthen their house? Did they save documentation? Did they have a go bag? And things of that nature? Or did they have insurance? And in looking at the data, several things stand out, and a lot of these won't be surprising, but some are quite interesting. One is that climate change impacts are experienced locally. We can characterize them nationally. They're a threat to the Philippines. But the fact of the matter is, and as Derek was pointing out, people have different means in different places. They even have different histories. They have different languages. They reside in different geographic locations that have different sorts of vulnerabilities. So climate change really is, while national policies are needed, it is experienced at a very local level and understanding the differentiation and how different localities experience climate change is essential to formulating interventions and policies that are meaningfully going to be needed in order to effectively adapt. A second observation is that, these are the not surprising ones, people with greater access to education, with greater wealth, tend to be more prepared and engage in more preparedness activities. What was really quite interesting, and one of the things that we look at is mental health, and we measure climate anxiety. And one of the most important factors in determining whether or not people engaged in preparedness measures was whether they felt a sense of self-efficacy. So for people that felt that they could do something, they actually tended to actually do it. Another observation we had is that and again, not surprising, climate anxiety in the Philippines is quite high, and higher for the younger people are. So there are high levels of anxiety, high levels of depression, high levels of fear about climate impacts. But what's really, truly interesting is that in addition to the fact that these things are high, Filipinos remain optimistic. And if you combine that optimism with the notion that a strong sense of self-efficacy is also highly related to preparedness, there's an intervention there that can really be relied on. And so focusing on people's well-being, Derek was talking about the mental health impacts vividly. Focusing on those kinds of interventions can have tremendously positive benefits. They're not a substitute for government policy and government intervention, civil society intervention to improve adaptation measures, to work on infrastructure, et cetera. But they are a way to engage with people, to have them fully engaged in their own preparedness measures and their own adaptation measures that are informed by their own local experiences. So I'll stop with that and look forward to engaging the panel and all of you with any questions.
Great, thanks so much, Enzo, and thanks for sharing us some of your findings and the interventions that came out of your findings. So lastly, before we open it up to the audience, Dr. Mahmood, based on your current work and previous experience leading various global agencies, including the IFRC, how do the issues of climate and health intersect with other sectors? So with politics, with economics, with business, maybe even with history. And what is the business case or economic case for systems level whole of society approach? And how do we enter this approach based on the lived experiences of people like Derek and her communities?
Yeah, thank you very much, David. Such a pleasure to be here and catching up with some old friends as well. Let me start with my own personal story first. I worked in the humanitarian sector for many years. And as a younger humanitarian, one of the disasters that really struck me was the flooding, severe flooding in Mozambique. I'm an obstetrician and gynecologist by training. And during that crisis, a woman had to climb up a tree, deliver her baby, cling on to the baby, while a South African rescue helicopter saved her and the baby. And that lived with me for a long time, the image of that. And 19 years later, I was in Mozambique again after a flood with the IFRC. And as I was looking at our programs, I started to talk to the midwives and recall the story of this woman who gave birth on a tree. And she smiled at me, pointed at the child, and said, "Oh, his mother just gave birth on a tree." So I asked myself, was I putting Band-Aid on gaping wounds with the work that I was doing as a humanitarian worker? I really questioned myself. And why is it that, and 20 years later, we have not been able to address the most vulnerable, the most at risk? We haven't been able to, allow good access to health, and we haven't been able to be better at preventative measures. And it was about the time that I was questioning and being introduced to this concept of planetary health, which is exactly 10 years since its first Lancet commission in 2015. And planetary health is so important because I realized then that we have been doing things very much on a reflex basis, very much siloed, and not looking at it through a systems approach. So what planetary health offers is this, that there is an inextricable link between the health of the planet and the health of human civilization. And that at the center of it is human dignity, equity. It's about justice, it's about economics, it's about social well-being, it's about health. And therefore you can't separate health from other things. And if we look at health itself and the determinants of health, 80% of the determinants of health are outside the health sector. And yet, the health sector is supposed to cope with all the things that are happening as a result of climate change or any disasters or outbreaks and so forth, when actually health is everyone's business. So as I undertook then to return home and set up a planetary health center, it was really about how do I now start at a local, national level to try to change the way people look at health. And of course, that came exactly at the time of COVID-19. So that was the opportunity to say, hang on a minute, COVID-19 didn't come out of the blue. It was loss of biodiversity, encroachment into natural habitats. It was about, the way we live, the way we run our economies, and the spread of disease. So I think that, coming to your question, how then do you look at it from a political, economic, social lens? It's all linked. It is inherently political. Climate change is political. Climate change, as one of my colleagues always says, is the crisis. The problem is the lack of political will and the lack of ability for us to come together to use the innovations and the knowledge that we have to actually address it. We have the solutions at hand. So coming back to systems, what we've done, at least in Malaysia, just to share the context, is we've been able to really advocate, and this is where academia becomes really important. I come from a university, Sunway University, which is very well affiliated with this center. I think one of our founders is also a philanthropist here. We've decided that this center is a bit of a think and do tank. We will do research, but most importantly, we will do research that will influence policy and action. So what we've been able to do is really gather the large body of evidence on climate and biodiversity loss and health, and bring that in good communication sound bites to the government, bringing the economic case of why it's important to protect the planetary boundaries, that with every planetary boundary crossed, there is a cost to the government, and there's a cost to society, and there's a cost to health. And I think with this kind of communication and evidence, what my appeal today is that with all the rich academia in Harvard, we've got to learn to de-jargonize the science, and we've got to learn to communicate in ways that people understand, whether it's community level, whether it's local government, whether it's the chief economist of the country, or whether it's the prime minister. So we've been able now to develop a national planetary health action plan. What it will do is tackle all the different aspects, whether it's economic, energy, health, social, education, and so forth. And what it will do is hopefully break the silos in looking at how we develop as a nation. As you know, ASEAN, we are the chair of ASEAN this year, and ASEAN is a very wealthy region. It's the 5th largest economy in the world at the moment. And with that, also a drive from ASEAN leaders to continue growing. And we've got to make sure that in developing that growth pattern, we don't destroy further and cause more climate change events in Philippines and others, and including my country as well. So I think the message that I would like to give is that how are we then as health professionals using our voice? The UNDP Human Development Report identifies that we are now in what is called an uncertainty complex. One is the dangerous changes of the planetary changes of the Anthropocene. So basically, we have caused these issues. The second is the geopolitical sweeping societal transformations and widespread polarization. This creates the perfect storm for everything to go wrong. And I think with this uncertainty, the more clarity we have in how we work with systems is going to help us. Now, how do you get the attention of politicians and governments to be able to pay attention to this? And this is where people like Derek become really important. Community mobilization, young people. So we look at it through 4 levers. One is communication. And I keep stressing communication because if we don't communicate well, who understands what 1.5 degrees is when we're actually heading to 3.1? Second is education. We need a revolution in education. I think in everything that we teach and we learn, we've got to address what are the existential crises. Now, how does your study of anthropology or politics or history or medicine, how does that react to the changing climate patterns in the world today? How does it react to the planetary crisis that we're facing? The third is looking at governance. We have a whole fragmentation of governance at the moment. You have different COPs going on and they don't talk to each other. Whereas the biodiversity COP is related to the climate COP, and the biodiversity COP with the digital sequencing agreements is very much related to the World Health Assembly's pandemic treaty. So how now do we make sure that even through the legal frameworks, we're able to have some commonality, some understanding that the linkages between different frameworks has to be made. So this is another area that we work. And of course, that governance also has got to be governance at local and national level as well. And finally, the role of business. I think we cannot ignore the business sector because in my region, at least, in my country, 80% of our economy is driven by small, medium enterprise. We've got to engage with the private sector. And the elephant in the room is the fossil fuel industry. And how many of us, as intellectuals, as academics, as health practitioners, use our voice to say that this has to stop. This transition to green and renewable energy must happen at an accelerated rate. And we are the most trusted people. Health practitioners and health workers are the most trusted people in the world. And yet we are failing to connect that our patients get ill because of the things that are happening externally to the environment. And I think the onus of responsibility is on us to raise our voices and speak up. We can't be responding to disasters all the time. Disasters are not natural. They are an interplay between vulnerability and hazard. And if we don't reduce vulnerability and we don't reduce the risk of hazard, we'll constantly be on a humanitarian journey. And being an ex-humanitarian myself, I'm beginning to feel now how we really need to shake up now a whole different approach. The last thing I want to say as a health practitioner is that the health sector is a polluting sector. The health sector, if it was a country, would be the 5th largest emitter in the world. And therefore, we also have to tell the health sector that, yes, you're saving lives, but you're also causing a lot of damage. So, looking at decarbonization of health systems, this is something that we're doing a lot in our country, helping our Ministry of Health run decarbonization, looking at how we look at our supply chains. And if I give you a simple example, the choice of inhalers that you use if you're asthmatic has a profound impact on the climate. An inhaler versus a turbohaler, the damage from an inhaler is thousands of times higher than a turbohaler. So how is it that we are not educating our doctors about this? They're prescribing without understanding the impact on health. The choice of anesthetic drugs, right? We have something called desflurane, isoflurane, and sevoflurane. And in most hospitals, they're still using desflurane, which is thousands of times more polluting than sevoflurane. So even simple things like changing a policy on what anesthetic drug you use or what inhaler you prescribe can actually contribute to improving reducing emissions and therefore reducing the impact of climate change. But I'm going to go back to the fact that we have to start speaking up. And I think the time is now. We are teaching young people now in our universities. We're running a program on not just teaching them about climate anxiety and activism, but also diplomacy. We've got to get young people into delegations because this is going to affect them. The latest report now from Exeter University and the actuarials in the UK predicts that by 2050, we will lose 40% of our population because of extreme climate events. And that's 4 billion people we're talking about. So I think that, until and unless we take this with a lot of urgency, take it very, very seriously, make sure that this is a cross-cutting issue in education, we make sure that our voices are heard, our research is meaningful to policymakers and decision makers, then I think we will not be able to progress otherwise.
Well, thank you so much for your remarks. And you can see here from our panelists that we've taken from a very individual, personal level to how we use the academy to generate the knowledge to inform the policies, and then how those policies can inform global action. And then, as Dr. Mahmood pointed out, how we still need to rise, right? And what we still need to do. So right now, why don't we open it up to questions from the audience to see how you can share your experiences or ask your questions. We have 2 microphones. If you can go up to the microphone, that would allow everyone in the room. The microphones are at the top of the stairs. That will allow everyone in the room to hear your question. And I really encourage students to come. Yes, Jay.
So, okay. Just a reflection on the very enlightening and moving comments of the panelists, and then a specific question. So you've stressed a lot of this, the health impact of climate change is local. The impact is local, the response is mostly local. You've also stressed the need to give local communities a voice and the need to listen. Which led you to the conclusion that local organization is important. And I'm glad you raised COVID because your remarks on COVID and Derek's remarks on exacerbating already existing inequalities reminded me a lot of the dilemma with COVID, where the impact was not equal and the recovery was not equal. So they say, oh, you have to work from home. And you're saying, if I don't work, I don't eat. And, I have to go out into the community or I'm a frontline worker. And they said, oh, you have to isolate at home. I said, well, with my extended family in one room, help, there's no space. And so you go on. And then you talk about underlying comorbidities because of lack of access or equal access to health. So a lot of what you were talking with COVID reminded me about the current topic. So then the specific question, and this goes back to Derek, so you are a grassroots community organizer. Often we say community, but it's communities. And often there are differences and conflicts within the communities. So my question for you is, how do you reconcile differences in communities to make one community voice? And how do you mitigate these differences for reconciliation? Thank you.
Okay, thank you. Yeah, I expected that question. Well, communities are they're united. In my experience, in my 31 years of community organizing, they are basically united. They have common interests. They have common aspirations. In my experience, we separate when someone outside the community would impose something that it would divide the community, especially like, for example, projects. There are other side that they would say that these projects are good for your community, and saying that without actually consulting the community, what we need and what our realities, understanding our realities so that you better understand our needs. But someone would impose because of, I don't know, from from my experience, like fossil fuel companies, that's the start of being divided. That's why, communities will start will start dividing themselves because of influences from outside the community itself. So that's the reality that I've been, trying to address in our community organization, because we do not have power, we do not have influence, we're not socio-economically, our status are not really, we do not play influences to corporations or to governments, but our strength lies in our unity. Our strength lies in our number, because, with that, we try to convince people that it is our community and we have lived there for and we have been together, and we should be the ones who are bonded together, and acknowledging the fact that we have our own assets, we have our own agencies, we have our own resources. For many times, we can, we have our source of livelihood. The hell with your coal plant. Our seas, our nature is abundant and giving us more than enough. But when you came, it started the whole chaos. So that's how we do it. We organize our communities. So we find our common interest, and from the perspective of justice and from the perspective of human rights, we have our lives to depend on also, and our children's future to defend against these divisions.
Thank you.
Okay. Next question, please.
Thank you so much for being here. This has been wonderful. My name is Ashna Shaparia. I'm from Singapore, and I'm studying at the Kennedy School and also doing a business degree. What I would love to ask all of you about is more about the region as a whole. So I think the perspectives we heard on the panel were wonderful, because we went into almost perspectives of each ASEAN country and how these health and climate change challenges are manifesting within our individual economies. But while we're the fifth largest economy as a whole in the world, the geopolitical forces are against our favor at the moment. And so I'm also thinking about how we can mobilize as a region to be able to push along these climate change and health impacts that are facing our individual communities at the local level in a way that the progress can be witnessed in each of these spaces.
Great, thank you.
Yeah,
Dr. Mohammed.
that's a great question. I was waiting for that. So ASEAN, as you know, has 10 member states, and the current geopolitics of the world, I think ASEAN has always been in the middle. I always say that we exert what we call middle soft power. We're a pretty neutral region. But I think that in terms of the priorities for ASEAN at the moment, if you look at the social cultural pillar, among the 5 priorities listed, climate and health are 2, which is a great thing to have among the priorities. Now, if you look at the region itself, there are some things we can be quite proud of. For example, the Transboundary Haze Agreement. This is something quite historical. I mean, it is, it took a long time. First, it was the blame game of who was, burning and slashing the oil palm estates. But eventually, because of the health deterioration in the region, the Transboundary Haze Agreement came together. I think this year, what we are pushing for at least and advocating is to look at, a regional health approach for certainly, for lessons from the pandemic have really pushed us to have a center for disease outbreaks. We need to be able to have our own data. And now, with the CDC and others facing so many challenges, we have to find reliable data sources, because this is going to be quite critical. The other, of course, is looking at health itself from the climate perspective. I think the environmental side of the ASEAN House is now having to work with the health side of ASEAN to come together. Now, will it happen overnight? I don't think so. You and I, coming from ASEAN, know how we work. It's always by consensus, and sometimes consensus takes a long, long time. But I think that we can already start initiatives. For example, I'll give you an example that there's going to be an ASEAN Urban Forum in, I think, August, yeah, and where we're inserting health into that, we're inserting climate into that, because that becomes a resolution taken into ASEAN through the ministerial process. Also, the ASEAN ministerial meeting for health ministers meeting will be early next year. So that's how you also insert it. So I think we've just got to be persistent. But one thing I know about ASEAN is that when it's a few countries that are the main players, right? Malaysia, Singapore, Indonesia. When these three adopt certain things, then the rest are likely to follow. So we've got to, bring the stronger, so to speak, countries to lead by example and move forward. Now, we're very excited about this National Planetary Health Action Plan. It's the first in the world. So we're, encouraging our government to say, look, if you do this right, this can be a model for the region. In our higher education blueprint for the next 10 years, planetary health and sustainability is one of the pillars. In our economic plan for the next 5 years, planetary health is one of the pillars. So if we can show the region that Malaysia can demonstrate, these things, and we're now working quite closely with Singapore as well, looking at heat, for example. There's a major problem in ASEAN, particularly in urbanized settings. So Singapore, which is the richest ASEAN country, is the most vulnerable in terms of heat. So, there's a lot of cross-learning now that can happen, and, showing that no matter how rich or how poor you are, you're exposed to the same risk. And in fact, sometimes you're exposed to more risk because you're more developed. So I think it's work in progress. There is an ambition, but there's also some not very good signs of some countries now backtracking on some climate agreements, and also pockets of conflict, as you know. But, I think we just have to persist and, chip away and use the examples of where we've done something well to show that we can do it again.
Thank you. Bak, you want to comment on that?
I just want to ask very quickly about that. So we had several efforts within the region for combining all activity related to this, from sharing data, routinely correct data, surveillance system for climate change pandemics. We've been working on the Southeast Asian One Health Network among universities over the past 15 years, and currently a number of activity with the Center for Coordinating activity related to pandemic preparedness within the region. So, yeah. I mean, efforts exist and have been working efficiently. The idea that from now, the perceive of the risks are different across nations, and how to translate this data through local policy and action are so heterogeneous. So it's important for us to improve the capacity to use the data and the mechanism for translating this information and evidence to the local level. Thanks.
Great. Thank you. Next question.
Thank you so much, the panelists, for your very excellent and important perspective. I am Abir Abdullah, a photojournalist based in Dhaka, Bangladesh. So I have been covering the impacts of climate change for more than a decade. I really appreciate your perspective from your different expert genres. But perhaps my question is, from a bit different perspective, every stakeholder is important for combating health and climate issues. Perhaps my question is the role of media. Mm-hmm. Because media can reach the way no other stakeholder can reach immediately, and in terms of when the situation is urgent, important, and when the situation is really, really need emergency attention. But then the role of media is now very complicated, especially misinformation and disinformation through social media.
Yeah.
So I'm sharing my experience for the last unpredictable and surprising flooding when nobody was prepared. So then my question to all of you, or maybe especially the humanitarian expert or the rescue and the preparedness expert or the policymakers, how you can immediately inform the communities with proper information. Thank you so much.
Yeah, let me start by saying that media is critical. We have just concluded a training for 30 journalists. We'll be doing this 3 times a year for the next 3 years on different aspects of planetary health, including, we just had the second one, in fact, just about a couple of weeks ago, and that was on heat. Because what we need to do is, first of all, equip journalists with the science, the understanding of the linkages between, what we see, the planetary damage and health and society. On your specific question on how do you send the message to communities, this must be through civil society organizations. I've worked in Bangladesh, so I know how frequent the cyclones and the floods are. The Bangladesh Red Crescent Society has been using megaphones, bicycles, going around to communities, warning them, simple measures that are very localized. So if you look at the typhoons that have hit Bangladesh, the death rates at one point was about 200,000 and now has been reduced to 2,000. It's still a high number, but that's because of community mobilization, and I suspect the same in Philippines as well. It's about getting information and knowledge to local communities and using local languages, local knowledge to spread the information. But journalism becomes so important, media becomes so important because you are the ones who provide the truth. Right? Now, your question on disinformation and misinformation, there's a wonderful book called Dark PR by Grant Ennis that I think everyone should read, because these people have invested in creating disinformation and misinformation. I like the Yale University, the psychological reactions, the spectrum from the alarmist, the believer, to the one the denier. And we're always sometimes focusing on the deniers, but actually 60% are actually either really people who believe and understand climate change or maybe sitting on the fence. And I think we've got to target that group. And you can't help it. Just as, disinformation is being paid for. This is not free. There are people paying to spread disinformation. But why aren't we paying the same amount of money to spread information? So there are a couple of initiatives, and in fact, I think one that is looking at standing up some health voices to be doing this. The coalitions of advocates, and we've been discussing as well with Harvard FXB on how you use community mobilization and so forth. So I think a lot more has to be done, but it starts with, first of all, using media as your ally, giving them information and understanding of science in simple terms. And if you're interested, we are running this 3 times a year for the next 3 years. We've got a grant to do this.
Yeah, I would just add that I think media is crucial for several reasons. I mean, one, we're very fortunate on our team to have a former journalist on the team, and his ability to communicate our findings effectively through national and local media has played a huge role in raising awareness. And so it's one thing to do good science, good research, but if you don't translate that into actionable information that people can work with, then it remains siloed and effectively unimportant. So that's one piece of it. I think the second is the language that's used. It has to be understood by the recipient. And I think one of the issues in Typhoon Haiyan was that the warnings that were given around storm surge were interpreted as not as dangerous as they truly were, because the storm surge in that particular case was the equivalent of a tsunami. But the term storm surge was not immediately well understood. The third piece is that I think increasingly technology is being used in more sophisticated ways to get much more narrow information that's highly localized. So when you normally get, like, for example, a weather forecast, it's usually over a fairly broad area, but increasingly there are micro targeted forecasts that are being provided to government that can lead to early warnings that can be communicated. So technology is being, I think, utilized in ways to better connect to communities within local contexts. So there's a lot that has happened, is happening, and still needs to happen around effective use of media.
Great, thank you. I think we'll have 2 more questions. We'll have time, so Tika, please.
Hello everyone. Very glad to have you here. I'm Tika, originally from Indonesia, and I'm right now studying global health in Harvard Medical School. To give the context, my hometown, my house in my parents, there just 2 days ago got a flash floodings and everything just submerged under the water for like 3 meters. And then they're right now still in the recovery phase. So like my questions is related to that. And it seems the floods will be more frequently to come. My question is, given the increasing frequency of climate-related disasters and the impact of the communities, how do you think that might be balanced between the immediate humanitarian response with the long-term community resilience building? And what the systemic barriers have you encountered when trying to shift from reactive crisis management into proactive disaster preparations? And maybe it's also related to how we might be better to address the power dynamics that often prioritize the external expertise over the local knowledge. Thank you so much.
It's a big question. And we have another one. So who wants to take a tackle at that question?
Yeah, I'm happy to. Just first of all, I'm very sorry about your parents' home. That's a lot of water, and that's truly unfortunate. I'm sorry to hear that. I think in a place like the Philippines, it's exposed to frequent hazards that are constantly happening, and so recovery becomes a big issue. So I think the first thing to sort of point out is that recovery is not equally experienced. So for example, we ask people, we include in our survey a list of questions around disability, and while persons with disabilities perceive risk almost the same as the general population, have roughly the same level of access to information, the recovery is it's a completely different story. Twice as many people say that they have not, that with disabilities say that they have not been able to recover from disasters as compared to the general population. So on recovery in particular, there are a lot of different influences that determine how quickly a community can recover, including things like disability, but also whether or not that community happens to be experiencing other things like conflict, for example, or whether or not that community is well-resourced and whether or not they have taken previous adaptation measures that reduce the impact of regular hazards. So all of those things affect the ability to recover quickly. There's an inherent trade-off between the kind of long-term building adaptation versus immediate response. But for sure, preparedness is a far more cost-effective way of dealing with hazards than repeatedly responding. You do want to increase the efficiency and effectiveness of the response, but you don't want to do that only. You also have to think about ways of reducing the impact through effective preparedness measures, and there's a balance between those two. A lot of the experience I've seen from my experience in the Philippines is when there is a real commitment at the local level, and I think local leadership is really important here, towards professionalization of preparedness and then investment in those measures. the results are really good. It's when you, for example, utilize political appointments to put someone in a position around response and preparedness who has no experience in that you run into problems. So the professionalization piece is also, I think, a really important element of that.
Great, thank you. Okay, our last question then.
A final question was, I was very struck by Dr. Mahmoud's point or definition that an emergency is in effect the interplay between vulnerability and hazard. And it's a shame that we don't have a virtually panoramic, capacious view on how to minimize those vulnerabilities and hazards. In light of this, in the absence of a capacious, almost God's eye view on a solution, how do you perceive the role of artificial intelligence as a way of weaving together our disparate solutions and highly localized solutions in terms of accelerating models of climate change disasters or coordinating responses? Thanks.
Last one.
This is a topic we are grappling with actually at our center. We're looking at artificial intelligence and looking at pro-social AI, right? What is it that we can use artificial intelligence for to benefit society? I think there's no doubt that artificial intelligence can play a major role in, looking at data analysis, giving us, very, very localized data, and also looking at harmonizing some of the, outcomes of previous interventions. For example, seeing what worked, what doesn't work, looking at mapping vulnerability. All that can be done by artificial intelligence. Ultimately, it also relates to Dika's question, right? The investment in what we call disaster risk reduction, community resilience, making sure that it's actually very locally led. Because no one knows communities better than the locals themselves. So you can harness artificial intelligence to go deep down into those kind of minutiae details. But on the other hand, artificial intelligence is extremely high in its emissions. So we are now looking at how do you balance that now, using a tool that potentially can give us a lot of good, but also can do a lot of damage. So, I think the jury is out. The pro-AI will say, no, the benefits will outweigh the emissions. But, the emissions are staggering. And for us in the region, in ASEAN, everybody now wants to build the data centers in our region because labor is still quite cheap and, it's quite safe in the region. So we will be facing this, right? And I'm a fairly loud voice in my country, saying to the government that if you want to do this, then you've got to make sure that your energy source for powering the data center has to be a renewable energy source. So I think AI is going to help us in many, many ways, but I think we also have to be very cognizant of the fact that it's also a very high emitting, tool, right? So, yeah.
Great. Well, thank you so much. I know there's other questions, but we are unfortunately out of time. So I invite you to come down and speak to our panelists directly. But I just want to say again, thank you, first and foremost, to our distinguished panelists for making your journey today, some closer than others, to join us in sharing your perspectives. And thank you to the organizers at the Asia Center and the Asia Center's initiative in Southeast Asian Studies. So thank you so much. Let's give them a round of applause. Lunch will be, we have boxed lunches for all of you, and that's where the breakfast is. So just head up the stairs into the little reception room, and there will be boxed lunches there. And we'll start at 1:30. Thank you so much.
Thank you.